when I developed the MyEllevate procedure, it was mainly for non-removal of the skin. And these doctors have taken it to a whole new level. So I'd really like to just talk about how you guys came up with the concept of the MyEllevate Plus in the beginning. Jason?
Well, I listened to Barry, and Barry says, you know what, we should be taking some skin out.
Sure.
So, we talk pretty much every morning, and we kind of refined it with your help. And we find out actually nowadays in my practice in Florida, 8 out of 10 patients are getting the Plus procedure, which is basically MyEllevate with some skin excision behind the ear.
The MyEllevate procedure was great, no sutures, no incisions, and we do webinars, and we set up a webinar for the MyEllevate, and we had 500 people on there, unheard of. And then they started coming in.
But Frosty was on there.
And your bird was on there.
My Frosty,
the bird knows more than we do.
I think you got more calls for Frosty than
I think I did. But what I found when the patients came in, 60–70% of them were older.
They were not candidates for the regular Elevate
Our lasers, our energy sources could not do enough tightening of their skin. So that's where the beauty of not opening most of the field is still there, but to do a small excision to put them over and now make them candidates is where this really came about.
It's basically a new version of a surgical neck lift.
Sure.
That's done under generally local anesthesia in a short amount of time and gives you amazing results with a very limited downtime. I mean, the way I explain it to the patients is, if you have a lot of heavy jowls and a heavy neck, you need a facelift. No question. But if you've had a previous facelift or your problem is just in the neck, this is a great viable alternative to a facelift.
Yes.
Right.
So Jonathan, I was going to ask Jonathan. Jonathan, you're young. We're not old, but you're younger than us. So you are very well trained.
Thank you.
And
yes.
you're very well trained in very complex procedures. And I know you're doing MyEllevate Plus. So what do you think about it as a young surgeon?
I love the procedure. As someone who, as you said, trained in classic face and neck lift, I find the concept to be very easy to pick up, very easy to translate to solving a problem. This is a great solution for a problem that doesn't require a full facelift. The pre and post facelift crowd now has something that can make them look younger and more rejuvenated.
Absolutely.
And I think our number one patient is someone who has had a previous facelift and they don't want to go through that again. And their face generally looks good, but the neck recurred a bit, which it does over time. So this is a very quick, minimally invasive procedure to correct that neck without having that recovery and just basically what you have to go through to get a regular facelift.
And that's a huge category of patients for this, but the other large category is those who are borderline facelift, but just wanted to have nothing to do with that larger surgery. And they gravitate toward this, and it looks really good.
And it's quick. The procedure is quick. In my hands, it's 75 to 90 minutes. The recovery is a few days, and it's generally done under local anesthesia, which so many patients just don't want to go to sleep.
Yeah, absolutely. And during the development of MyEllevate, I was using it as well with facelifts and neck lifts, and I continue to do that out in Beverly Hills. Patients are very happy, and I do some other things as well, SMAS, and I know we all do deep muscle surgery, but I find it a great alternative to opening the neck. And I've sort of, moved away from opening the neck. I know you guys do everything, which is great, but I think that's the beautiful thing about the MyEllevate Plus. It kind of works across the spectrum, depending on what your patients want and what you want to do. What you think
I
would
think
work
it's
best.
improved my regular facelift technique because I've taken some of the components from the Plus and put it towards my regular facelifts. So I think there's kind of a mix between those two procedures now in my hands.
Thank you guys so much for talking about all this. I love your support, and thank you to the Plastic Surgery Channel.